Treatment protocol. B. Initial reference and pair Goiz. A minority of patients come to the consulting room with one leg shorter or longer than the other. In many cases, the patient was not even aware of this. This may be due to many causes. The patient may already have been born with this difference, or it may be due to an osteopathic problem, a surgery, an accident, or suffering from knee or hip osteoarthritis. But it may be possible that the cause is energetic and the patient's so-called Goiz pair is unbalanced. This pair is generally located in parietal contralateral kidney, and it is usually caused by strong physical or psychotrauma. This pair will be discussed in detail in the section explaining all biomagnetic pairs, and explanations will be given on how to balance it so that the patient's legs have again the same length. The clearest initial reference point the therapist can have to compare the length of the legs, and therefore being able to start checking the patient, is the matching of the two legs. That is, when the right leg has exactly the same length as the left leg. Sometimes the therapist believes that the patient comes to the consulting room with uneven legs, but in reality the cause is simply that the patient is not lying straight on the couch. The therapist should then ask the patient to lift his upper body like if getting in a sitting position. Then the therapist should stretch and shake the patient's legs, and subsequently the patient will lie again on the couch, this time completely straight. If the patient really comes to the consulting room with the Goiz pair unbalanced, and the therapist manages to match the two legs using the information described in detail when we discuss later about this particular pair, then the therapist can already begin the complete scanning of the patient. But if he cannot match the two legs, despite the fact that the patient is lying quite straight on the couch, and despite all the other comments made above, then the reason for the asymmetry of the two legs is probably anatomical. In this case, given that the two legs cannot match, the therapist will use a piece of masking tape to put a mark on one of the patient's shoe heels. This mark should pinpoint precisely in the heel of the longer leg how high the shorter leg reaches exactly. If there is a problem with the shoes, or if the therapist does not like checking the patient with shoes, the patient could be barefoot. The therapist would then draw a line on each patient's bare feet, or would put a piece of tape. This would give a comparative benchmark. Once the initial visual reference that will serve as comparative tool has already been established accurately, the therapist can then polarize the patient's body with the help of a magnetic rod, and then start the full scan of the patient. And when Goiz pair's turn comes in the scanning list, then the therapist will see if this pair is active or not. And if the pair is active, then the cause will not be anatomical or structural this time, but will be an organic cause of renal dysfunction.